I just want to thank everybody for being here. It's an honor and privilege to be here. This is me. Got board certified in psychiatry and addiction medicine. Been in Charlotte County, the eye of the Hurricane Ian, but we survived. And owner, founder, medical director of Paradise Behavioral Health. Before I begin, I just want to share with you this video.
Can I get the double quarter pounder with cheese meal?
Not supersize.
I think I'm gonna have to go supersize.
It's hard for me to watch him go through this.
It seems like you're starting to get addicted to it now.
You saw these numbers, right? These numbers are outrageous.
Unfortunately, you cause some major harm to your heart, your liver, your blood.
You're gonna die. You'll die.
I want more.
You gotta stop.
That was just a little icebreaker, but the more I listened to them, even just the introduction, and after doing the research on weight gain causation, a lot of the stuff that he was talking about really made sense. So what I'm gonna do is just not pick on everything that's gonna cause weight gain, but a couple of things that I think is important for us to really delve into. Genetics, and that begins there, medical causes, the environment, our lifestyle, and my field, psychiatric conditions, as well as weight loss. Weight loss can cause weight gain, and I'm going to talk a little bit about that. I'm also going to talk a little bit about COVID and weight gain, but without further ado, as we know, the basic principle of weight gain, calories in and calories out. So that's it, right? Lecture's over. However, when discussing all the causes why we have an increase in appetite over a decrease in activity, that will actually explain it's not just about discipline or no self-discipline. So let's begin with where it begins, our genes. Anybody have any idea how many genes are actually related to weight gain and obesity? Just a guess. There are actually 400. And I'm not gonna go into all of them because we'd be here for weeks. So I'm just gonna pick on the ones that are important for us in our daily practice. And in order to understand that, I'm just going to pick on, this is what we call the leptin melanocortin pathway. And in that, this is what I call the appetite center of the brain. There's a lot more to it, but I wanted to just do it for simplicity's sake. Because believe it or not, I had difficulty even trying to figure this out. So I'm just going to keep it to two of the main hormones. These hormones, the leptin and ghrelin, they are the ones that are controlling whether we're going to eat or whether we aren't. And in order to really just understand how this works, it's better to just explain one. Okay, let's talk about leptin. The leptin is what we call anorexigenic, meaning L for weight loss. All these hormones come from the periphery. The leptin comes from your fat cells. It goes to the brain, the hypothalamus. It has its own receptors in the arcuate nucleus of the hypothalamus, and in there it produces pro-melanocortin. And from there, you have melanocyte stimulating hormone that comes out into the paraventricular nucleus. And this is what is regulating our ability to not overeat. MC4R. Ashley mentioned it a little bit earlier, but MC4R is what really is responsible for maintaining homeostasis of our weight. It modulates lipids and glucose. So that's why it's really important for us to understand that. And so leptin, and throughout all this, I would say, cycle, this is how we tell, or the body tells you, that you don't need to eat. But, of course, when it comes to normal physiology, you have to have the yin and the yang, right? So you got leptin, which I call Luke Skywalker, the good guy, and ghrelin, which I call Darth Vader, the bad guy. So if you, as you know, there is a yin and the yang. Ghrelin comes from our stomach. And it also goes to the same centers of the brain where it is actually acting on its own receptor. And then from there, it makes AGRP, agouti-related peptide. But the interesting is that peptide will actually compete with melanocyte-stimulating hormone and causes the opposite. It actually deactivates it. So in normal physiology, as we discussed in a previous lecture, this is normal physiology for us. If we don't have anything in our stomach, we have ghrelin. If we're full, the leptin comes out. So as you can see, any disruptions in what I've discussed, in any of the genetics, you're gonna have a propensity for weight gain. I like to break down the genetic causes into three things. Monogenetic causes, meaning a single gene mutation that is a part of that leptin melanocortin pathway. There are syndromic causes, the genetic causes. This is obesity associated with neurodevelopmental abnormalities and other organ system malformations. And of course, we all know, even with genetics, there is a situation with polygenic obesity. And that's what I call a culmination of bad genes in a weight gain promoting environment. So let's pick on the monogenic cause of obesity, congenital leptin deficiency. These people are born normal, but they're constantly hungry and they gain weight. And without treatment, they continue to eat, excessive eating, weight gain. Easiest way to test for that is through leptin concentration. The next thing is LEPR deficiency. That means you have a genetic mutation that can't make the the receptor. So you may have a lot of leptin around, but if your receptor is not there, obviously you're gonna have a problem with weight gain. And the third thing that can happen with leptin, the gene that makes leptin can also be mutated. So the problem is leptin then will not work in your body. The POMC, we talked about that. That is responsible for making melanocyte-stimulating hormone that then attached to the MC4R, which is this thing. So as you can see, it makes more sense to know the normal physiology so you can see where things can go wrong. So MC4R deficiency, meaning you don't have it, so you're gonna have weight gain. I didn't mention this, the SIM1 is actually part of that MC4R pathway, and it is also responsible for activating the response and the cycle of the MC4R. So if you don't have that, then you're gonna have what I call ghrelin, the bad guy, overcompensating and causing weight gain. BDNF is actually part of that cycle of normal weight loss cycle or decreased appetite cycle that attaches itself to the tyrosine kinase receptor. So if you have mutations in that, you're gonna have the issue where the weight loss center of your brain is not working. And then it's gonna be compensated by the weight gain. We're gonna just skip through that. So the second causation in terms of genetics is what we call syndromic genetic causes of obesity. Bardet-Biedl syndrome is a rare autosomal recessive ciliopathy. But the most important thing in relation to weight gain is that it can make you prone to type 2 diabetes. I think we all know about Prader-Willi. It is a genetic defect in the Prader-Willi gene. You will see in a 20-year-old already development of type 2 diabetes, and that is basically the reason why they have weight gain. And then you have microdeletion syndrome. They have developmental delays, intellectual disability, even autism with severe obesity. So I'm just going to touch a little bit of this when I talk about polygenetic causes, because I'm going to talk more about it later. The role of toxins can cause genetic mutations, resulting in hormonal imbalances. And remember, leptin. Leptin is what's used for weight loss. If you disrupt the leptin, you're going to have weight gain. All right, so I want to talk about medical causes. I'm going to just touch a little bit on hormones at the beginning. 3 things that I would like to say is the more common cause of hormone imbalances that causes weight gain. PCOS, I think really the most important thing we need to discuss with that is insulin resistance that causes the weight gain. Hypothyroidism is interesting. Even if you have normal thyroid hormones, but it's on the low end, you still have the problem where the metabolism is still not working as well. So even just a little bit of supplementation is going to help people lose weight. And if you don't, you still have a problem with weight gain. Cushing's, as we know, too much stress releases cortisol, which in turn causes weight gain. But you see the weight gain around the face, neck, upper back, and waist. One thing that I just read recently too is vitamin D deficiency. It is actually also considered a hormone, but it can also play a role in insulin regulation. So vitamin deficiency, some people will have a propensity for weight gain. So let's talk a little bit about inflammation and what is the thing that inflammation causes. Let's just say, in terms of arthritis, decreased activity. This is interesting, the obesity cycle. Obesity begets obesity. How does it do it? Fat cells are inflammatory. So when you talk about obesity releasing inflammatory chemicals, it leads to inflammatory disease. So it's just a vicious cycle that can happen. Narcolepsy. How does it make people gain weight? Well, for one thing, if your sleep is off, your body burns calories more slowly. But what also happens when you have daytime sleepiness, you're less active. That makes sense, right? So, propensity for weight gain. Celiac disease is also an interesting thing. It's not so much the celiac disease that causes weight gain. Actually, what happens when you have celiac disease? Your patients are mainly what? Underweight, right? But when you figure out what was wrong with them, you treat them, and what happens? They gain weight. So you gotta be careful. You gotta watch these people, these patients. Where is their weight gain? So that can happen. And of course, anemia. I mean, pretty much, if you're fatigued, you don't want to move around as much, you're not as active. And I'm going to touch on the last thing, the best part, metabolic syndrome. I don't want to go into the diagnosis. We all know what that is, but for the sake of this lecture, I want to talk about how metabolic syndrome causes weight gain. Okay, so in our society, we have this high glycemic, insulinogenic diet. How does that happen? It's just the way things have progressed in human nutrition. So if you have too much glucose in your diet, what happens? Chronic stimulation of the beta cells, which leads to hypertrophy and dysregulation of the cells. And you have postprandial hyperinsulinemia. and that causes the weight gain. There are other medical causes, even medications, but I'm just gonna put this, actually I'm gonna write a little piece on this on a Word document. If you want it, just let me know and I can hand it to you, or I can just email it to you. So let's talk about how environmental toxins cause weight gain. 3 ways. They create inflammation. Number 2, they disrupt hormones. And these are what we call endocrine disruptors. What really happens is it causes quite a bit of insulin resistance that promotes fat storage. And also, these toxins cause alterations of lipid metabolism, and it promotes the growth of fat cells. So let's pick on a couple of very well-known toxins that can cause weight gain. I think we know what BPA is, and it is essentially the ultimate endocrine disruptor. They've seen analysis of higher levels of BPA in obese children. So it's pretty much a given that this is going to disrupt the normal hormone growth patterns and causes weight gain. Phthalates. What are phthalates? They're actually found in makeup, air fresheners, plastics, food and drink containers, and medical devices. So the BPA and phthalates pretty much can cause insulin resistance, especially in healthy children. And what are PFCs? It's Teflon. Sorry. It's Teflon. So basically, they are endocrine disruptors. They can depress thyroid function and alter sex hormones. Artificial sweeteners, I think I actually touched a little bit on this, particularly fructose. And how does fructose cause weight gain? It actually makes your leptin not work. There's such a thing called fructose-induced leptin resistance. And sweeteners, I say, can also alter your gut microbiome, leading to higher risk of chronic diseases, including obesity. What are VOCs, volatile organic compounds? Found in many households, they promote inflammation, weight gain, and make it harder to lose weight. Heavy metals, lead, cadmium, and mercury. These are the most common ones that actually cause weight gain. And how do they do it? Immune dysfunction and inflammation. And they can actually affect metabolic syndrome. In fact, if you find these metals, they're usually higher in people with metabolic syndrome. Just touch on a little bit on lifestyle. I think we understand that, but I wanted to just really delve into some of the reasons why it happens. A diet filled with engineered junk food, heavily processed food. They are cheap, but they taste good, and promotes overeating. And they don't have a lot of good calories in it. Exercise, sedentary lifestyle. But I do want to say that exercise also is no guarantee that you won't gain weight. It goes back to the thing where you still have to not put so much more in than what you put out. How does stress do it? Cortisol, right, is the stress hormone. Increases appetite. And when you're stressed, what do? Some people do half. The other half is they tend to comfort eat. Perfect breeding ground for weight gain. Sleep. How does sleep cause weight gain? 2 things. If you're up late, what are you gonna do? You're gonna be doing night snacking. There is such a thing as called night eating syndrome, as well as the other thing that goes on is that it does cause a changing in your hormone levels, increase the hunger and appetite hormones, and you don't feel as full after eating. But also growth hormone, which is released at night. What is growth hormone for? It also helps boost your metabolism. So sleep can cause weight gain in all those 3 things. So let's talk about psychiatric conditions. Psychiatric conditions that can cause weight gain. I want to pick on major depressive disorder because, as you know, in the DSM criteria, we talk about the change in your appetite, as well as low energy, inertia, and hedonia. So you got two things going on here. The increase in appetite as well as the decrease in output. But most interestingly enough, what people need to understand is that if you're already overweight, you're going to be a higher risk for depression. As well as if you're depressed, you're going to be a higher risk for obesity. So it's like, that's also the yin and the yang. So when you're treating somebody with depression, you really have to, or let's just say you're treating somebody for obesity and weight loss, you better rule out are they having problems with depression? Because that's going to get in the way of your treatment and how to get that patient better. And the most common eating disorder is binge eating disorder. What is it? It's a consumption of large amount of food in a brief period of time, less than 2 hours, during which the individual experiences a loss of control. They eat faster than normal. They cannot control themselves, even if they're not hungry. The other second cause of eating disorders that cause weight gain is bulimia. But bulimia, sometimes they're normal weight. Sometimes they're a little bit overweight, but not that much. Because what happens in bulimia? You have compensatory purging, right? What I wanted to do was actually put these two together because they actually really connect well. When you're talking about food addiction, you're talking about sugar-sweetened foods, high-fat junk foods. What do? They stimulate the reward center of your brain, so you feel good. And sometimes these foods can be compared to abused drugs like alcohol, cocaine, nicotine, and cannabis. So addiction to food can cause weight gain. However, there's the flip side of the coin. What happens when somebody quits smoking? Weight gain, right? So they're trying to find other ways to help them feel better. They're seeking that dopamine. And even with people who quit using cocaine, as you know, cocaine is anorexigenic. When they stop, they're gonna gain weight. But the other thing is, people with addiction, when they quit using bad substances, they will often turn to food to help them feel better. So it's like you have to not, just because a patient is sober doesn't mean that you still can't monitor them for any other kind of addiction problems. Trauma is interesting. Can anybody guess which kind of trauma causes the highest, most common type of weight gain? Which kind of trauma? Physical, emotional, sexual. What would you guess? I'm sorry? Believe it or not, that's like the lowest. But I'm going to get to that later. It's actually physical abuse is the most common type of abuse related to weight gain. 50% have struggled with emotional abuse. So what happens? You do your emotional eating. 16 to 32% of patients with a history of sexual abuse have weight gain. Anybody can give an idea why they would have weight gain? And I've heard this from my patients, and it's really pretty sad, but why would a person who is being sexually abused gain weight, or why would they want to gain weight? Exactly. And I've heard this from my own patients who talk about they've been sexually abused. They said, I made myself overweight so I would not be attracted to my abuser. It doesn't work though. It still happens. And then you have these patients that continue to struggle with their weight later on in life. So the biggest topic, really, when I was like trying to figure out what is the biggest cause of weight gain among psychiatric disorders, it wasn't even that. There was so many articles in relation to psychiatric medicines. And this is probably the reason why you see people like Britney Spears not take her antipsychotics, because they don't like the side effects. So I could talk about this all day, but I'm just going to pick on the most critical ones that we need to know about. So the antipsychotics, when it comes to weight gain, the biggest one is clozapine and olanzapine. These are the older antipsychotics. They're still considered in the new generation class, but these two are the biggest culprits. But I'm going to tell you this much. It happens also with the newer ones. So the thing about it is, it's also genetically based. When you have abnormalities in an MC4R, the histamine, the leptin, the NPY, and the cannabinoid receptors, you have basically turned on the weight gain gene in somebody taking antipsychotics. So what are the antidepressants most commonly known to cause weight gain? SSRIs, especially the older ones. Anybody can guess how or those SSRIs can cause weight gain? When you have too much serotonin, you become apathetic. It kind of causes the opposite. You become lethargic, you don't care, and it also does stimulate the appetite itself. Tricyclic antidepressants, they do cause weight gain. That's why people don't like those older ones, and in my practice, we don't really use them that much anymore, other than for sleep, which is off-label. And mirtazapine. Mirtazapine is one of the worst culprits of it, but patients like it for sleep, so you really do have to watch out for the patients in terms of side effects and whether they are going to gain weight. Some patients don't, and if you understand, maybe they have good genes, they're not going to gain weight. In terms of new stabilizers, it's lithium and valproic acid. That's the biggest weight gain culprits. There are newer ones that don't cause those things. Unfortunately, they are not always as effective. 80-95% of dieters, they will gain weight. They'll gain the weight back that they work so hard to lose. How does it happen? As we know, weight loss is the way the body perceives that we're sick. So your body is fighting that. It's fighting it to keep your weight as it was before your weight loss. So metabolism slows down in order to store fat. Meaning the more you work out or manage your calorie intake to lose weight, the more your metabolism wants to compensate. What happens to the metabolism? Slows down, right? Because it's perceiving itself, oh, I don't have any food, I'm gonna starve. So normal physiology, your body is going to respond to it. Hormones also will increase your drive to eat. When your fat cells shrink, that's where leptin comes. So you're gonna have a decreased amount of leptin. And when your stomach is empty, or when your body perceives you as not eating as much, the ghrelin takes over. When you lose weight, your brain won't register how much you're eating. Food has a greater reward value after you've lost weight. And knowing those two things, the first, number one, number two, that kind of makes sense, right? In that the brain regulates the food restraint is not as active, courtesy of low leptin. So you're less aware of how much you're eating. And your genes may or may not be helping, depending on what's happening with it. This is the most important thing to remember also about weight loss. Your body is extra prepared for your second try. Anybody have any experience personally or with their patients who lost weight, gained weight, and they tried the same thing again and it didn't work? I see a lot of head nodding, and that's why. Because what you've done is that with weight loss, the body perceives it as being sick. So what happens when you're sick? You have an inflammatory reaction. It creates antibodies to being ill. So when you try to lose weight again, it's harder the second time around. Your body also has a favorite number, that's what we call the set point. And if you've been at a set point for years, it's gonna fight to get back there. And the thing about it is, we have to remember the hardest thing to do is maintain your weight after 1 year. Why? Because it takes a year after the weight loss for your leptin and ghrelin to go back to normal, trying to find that new set point. So when I have patients who actually do come to me for weight loss, I tell them, your second year is the most important. You have to make sure you keep doing what you're doing, or else it's gonna fight after that 1 year to get back to where you were. This is a little bit psychiatrically related. Weight loss may not be what you thought it would be. Your body may look different, thinking that this is not what I want it to look like. Stretch marks, loose skin can affect their disappointment in their weight loss. And what happens? Like, well, what's the point? I don't look good, so I might as well just go back to where I was. And the other thing is, this is very important to understand with your patients. Especially a lot of people, everybody here is in the medical field per se, more medication management or just medical treatment. You still have to understand with your patients, in order for them to be happy, and they're coming to you saying, I'm miserable, I want to lose weight, doc. Red flag. You have to understand, and you have to tell the patient, just remember, just because you lose weight, it's not tied to how you feel, whether you're gonna feel good. You have to figure out why that person is not feeling good emotionally. You have to attack that. And some things that can happen is that when you lose weight, you still feel guilty because you don't feel happy because you've lost 50, 100 pounds. And what happens when you still feel bad? You go back to your normal coping skills. You eat to cope with your feelings. So I want to talk a little bit about COVID. Latest study in January 2022, what happened in COVID and weight gain? Anybody can guess how many patients gain weight? If you just look at this little circle here diagram, 48% of people gain weight post-COVID. So we've got a lot of work to do, right? Things like anxiety and depression with weight gain post-COVID, there is a 50% chance of weight gain if you have depression and anxiety and during COVID. Other psychological distress, children at home, don't know how that is, but that's what it was. And not being able to check on your weight post-COVID. I don't have a scale at home, I didn't check, so that's the excuse people get. So let's talk about the perfect storm. Understanding genetics, understanding medical, environmental, lifestyle, psychiatric, and weight loss, they can actually affect the other, as you can see, right? So it's not as easy as saying eating more causes weight gain compared to less activity. So many factors are going into why people are eating more. Genetics, stress, lifestyle, medications, metabolic syndrome, eating disorders, addiction, trauma, COVID, and weight loss. All that will boost your appetite. But what the reaction, compensatory reaction is, you're not doing as much, and that results in weight gain. And what things happen for you to decrease activity? Fatigue, inflammation, arthritis, depression, right? So I've given you a lot of thought. It's not just telling patients, you gotta do this, you gotta do that. If the patients are not getting the results of their weight loss, then we gotta do our due diligence as physicians, as clinicians, to figure it out, help them, right? Okay. So in the end, multiple causes of increased appetite, overcoming decreased activity causes an imbalance, which is the greatest contributor to weight gain. So that's all I have. And anybody have any questions? I know, I gave you a lot to think about.